Good morning, everyone. It's really my honor to be with all of you this morning. I am a clinician and an educator. And in my role as education director, alongside my complementary roles at the Benson Henry Institute and MGH, this concept of well-being is very near and dear to me, personally and professionally. Over the past decade, there has been a new evolution in concepts such as burnout, resiliency, well-being within an occupational framework. In addition, we have seen amazing innovations in the ways these concepts are being explored within healthcare institutions. The present crises that we are currently facing, alongside the double pandemic of COVID-19, as well as the structural racism and its ensuing inequities, have only amplified the underlying challenges in healthcare provider well-being. With that in mind, I would like to offer a backdrop for your consideration. Resiliency is a multi-dimensional construct. In this seminal work done by Stephen Southwick and Dennis Charney, they describe 10 dimensions to resilience. This includes optimism, facing our fears, being able to do what is right, being connected to something greater than oneself, social supports, role models, physical and mental exercise, having flexibility and acceptance, and perhaps most importantly, keeping meaning and purpose alive in one's work. And we are understanding that well-being is a dynamic construct. It is balancing our resources, including psychological, social, and emotional ones, with our challenges. When our resources are able to meet our challenges, we do well. And so what does that mean for the healthcare provider, for the individual healthcare provider living within a complex healthcare environment? We are already asking a lot of them. We're asking them to avoid certain behaviors, such as alcohol and substance use. We're asking them to spend time doing other behaviors, such as exercise. We're asking them to develop practices, such as gratitude. We're asking them to learn how to spend their time well, making sure that they're always doing the right work. But to put this all on the individual is both unfair and it perpetuates injustice in the system. There is an organizational and national policy level responsibility, especially now that we are in the aftermath of this election. As this commentary in the New England Journal of Medicine states, organizations have a responsibility to integrate well-being into the fabric of the institution. They must ensure the safety of clinicians and sustain and support programs. And finally, at the national level, there must be imperatives for funding of such efforts, such as creating registries to understand clinician well-being. Today, we are truly fortunate to have thought leaders gather together and help us understand both the gravity of clinician well-being and explore possible solutions. It is important to acknowledge that this effort will require an integrative approach, and a sustainable solution must be one that is interprofessional and interdisciplinary. And so with that, it is truly my privilege to introduce our keynote speaker, Dean Michelle Williams. Dr. Williams is Dean of Faculty at the Harvard T.H. Chan School of Public Health and the Angelopoulos Professor in Public Health and International Development. She is an internationally renowned epidemiologist and public health scientist, an award-winning educator, and a widely recognized academic leader. Over the past several years, Dean Williams has taken a keen interest in healthcare provider well-being, writing numerous academic pieces in prestigious journals, policy pieces working alongside the Massachusetts Medical Society, as well as op-eds, including a recent Washington Post live piece alongside Arianna Huffington. But perhaps closest to my heart is for my 5-year-old daughter. In her virtual kindergarten classroom in the Boston Public Schools, her teacher had assigned her biography as the role model scientist for our children to see. Dean Williams' talk will be followed by comments from Dean Fidencio Saldana, Dean of Students at Harvard Medical School. As Dean of Students, Dr. Saldana has worked tirelessly to support and guide students in their individual and professional growth. His abiding commitment to medical student education has been honored by numerous teaching awards. He leads the HMS Wellness and Mental Health Initiative, a student-faculty program whose mandate is to develop programs and initiatives that promote the health and wellness of students across Harvard Medical School.